One of the biggest challenges that you as a caregiver can face is when your loved one's behavior starts changing. When this happens, it's very important to know why. Maybe it could be due to a change in medication, or perhaps a deficiency in your loved one's nutrition. Or maybe even a urinary tract infection. Yes, many people don't know that a urinary tract infection can trigger confusion, agitation, and depression, just like more serious-sounding conditions. But before you jump to conclusions about what causes behavioral changes in your loved one, it's important to rule out other possible underlying conditions, each of which requires specific treatments. If you suspect your loved one may have Alzheimer's or another memory disorder, you both need to understand what you're dealing with right away. The sooner your loved one is tested comprehensively and diagnosed, the easier it will be to manage the symptoms. How can you tell if your loved one has mild to moderate memory loss? He or she may have problems finding the proper words to say, may lose focus and attention, may be disoriented, and may have problems following directions or performing tasks that used to be easy. With more advanced dementia, your loved one may lose his or her social abilities, may start to wander, may exhibit inappropriate behavior, and may experience hallucinations. Remember that not all of these symptoms occur with everyone who has dementia, but they're all possible, and they can lead to frustration and depression for you as well as for your loved one. And also, above all, remember that your loved one's behavioral changes are not his or her fault, and that getting angry or frustrated won't help matters. Instead, approach the difficult behaviors with gentleness and patience.
Uncle Jimmy, would you like a sweet?
Yes, I would.
Make sure that your loved one is in the calmest environment possible, that he or she is getting adequate nutrition and enough water to drink, and some form of exercise.
I ended up there. We have the Chattanooga choo-choo chairs.
Jimmy, this TV is a little loud. I'm going to turn it down, okay?
If there are loud noises or voices, if there is too little or too much light, or if the room is too hot or too cold, either correct these things or move your loved one away from them. Lack of sleep or rest can also make your loved one irritable and hard to manage. And although you want him or her to have plenty of stimulating activities, too much stimulation